High risk of type 2 diabetes among COVID-19 patients. Type 2 diabetes is more likely to occur in those who have received COVID-19. Diabetologia has published the findings of a research by DDZ, DZD, and IQVIA. Human pancreas may possibly be a target for SARS-CoV-2, according to research. Reduced beta-cell insulin secretory granules and diminished glucose-stimulated insulin release have been found after a COVID-19 infection. COVID-19 illness has been linked to a rise in blood sugar levels in some people who had no prior history of diabetes. Infection with SARS-CoV-2 may result in a significant release of pro-inflammatory signaling molecules, cytokines. After a SARS-CoV-2 infection, the immune system may remain activated for months, reducing insulin's efficacy, muscle, fat cells, liver. However, it is not yet apparent whether these metabolic alterations are temporary or if COVID-19 illness increases the likelihood of developing diabetes in the long run. IQVIA, the German Diabetes Center, DDZ, and the German Center for Diabetes Research, DZD, undertook a retrospective cohort study to address this topic. The research was based on a sample of 1,171 German medical practices. In the meanwhile, we'll be checking in with you until July 2021. An AURI-infected control group was also included as a measure of the researchers' success in their experiment. Health insurance coverage, month of COVID-19 or AURI diagnosis as well as comorbidities were all matched across the two populations. The research did not include any participants who were taking corticosteroids. A total of 35,865 persons were found to have COVID-19 throughout the course of the research. There was a higher incidence of type 2 diabetes in individuals with COVID-19 than in those with AURI. Diabetes affected 15.8 out of every 1,000 patients infected with COVID-19, compared to 12.3 out of every 1,000 people infected with AURI each year. This study's incidence rate ratio, IRR, came out to be 1.28 after statistical analysis. COVID-19 patients had a 28% greater chance of developing type 2 diabetes compared to those in the IA group. Rathman summarized the findings by saying, "We have a group. Dehydration, weariness, frequent urination, and increased thirst are all symptoms of type 2 diabetes.